Question 1. A newly licensed nurse is taking the Nclex and encounters a question regarding a postoperative client who underwent abdominal surgery 4 hours ago. The nurse cannot immediately recall the specific protocol. The options include encouraging ambulation, administering pain medication, assessing the surgical dressing, and documenting intake and output. Using the safest Nclex guessing strategy, which intervention should the nurse select? A. Encourage ambulation immediately. B. Administer pain medication first. C. Assess the surgical dressing. D. Document intake and output. Answer. C. Assess the surgical dressing. Rationale. When unsure, choose assessment before implementation if the client is stable and additional information is needed. Question 2. A nurse receives report on 4 clients. The nurse cannot determine the exact disease process involved in each case. Which client should be assessed first? A. Client requesting a blanket. B. Client with oxygen saturation of 84%. C. Client awaiting discharge instructions. D. Client asking for pain medication rated 4 out of 10. Answer. B. Client with oxygen saturation of 84%. Rationale. When guessing, prioritize airway and oxygenation problems. Question 3. A nurse is unsure which provider prescription should be implemented first for a client admitted with suspected sepsis. Which prescription is most likely correct? A. Delay assessment until laboratory results return. B. Administer broad-spectrum antibiotics as prescribed. C. Restrict fluid intake. D. Place client on complete bed rest without assessment. Answer. B. Administer broad-spectrum antibiotics as prescribed. Rationale. Nclex frequently prioritizes interventions that address life-threatening conditions promptly. Question 4. A nurse cannot remember the exact complication associated with a chest tube. Which finding should the nurse address first? A. Mild anxiety. B. Oxygen saturation 86%. C. Dry lips. D. Request for water. Answer. B. Oxygen saturation 86%. Rationale. Airway and breathing concerns take priority over comfort needs. Question 5. A client reports sudden shortness of breath and chest pain after surgery. The nurse is unsure of the diagnosis. Which action is best? A. Assess respiratory status immediately. B. Offer reassurance only. C. Obtain dietary history. D. Provide discharge teaching. Answer. A. Assess respiratory status immediately. Rationale. Assessment of an acute respiratory complaint is the safest action. Question 6. A nurse is answering an Nclex question involving delegation. The nurse is unsure which task can be assigned to the UAP. Which task is most appropriate? A. Initial assessment of chest pain. B. Teaching insulin administration. C. Routine vital signs on a stable client. D. Evaluating pain medication effectiveness. Answer. C. Routine vital signs on a stable client. Rationale. Stable, routine, non-assessment tasks can generally be delegated. Question 7. A nurse cannot recall the exact electrolyte imbalance being described. Which client requires immediate attention? A. Client with peak T waves on ECG. B. Client requesting a snack. C. Client with mild headache. D. Client waiting for transportation home. Answer. A. Client with peak T waves on ECG. Rationale. Cardiac rhythm abnormalities indicate potential life-threatening instability. Question 8. A nurse encounters a priority question and cannot determine the diagnosis. Which client should be seen first? A. Client with respiratory rate of 8 per minute. B. Client requesting hygiene supplies. C. Client awaiting meal tray. D. Client reporting boredom. Answer. A. Client with respiratory rate of 8 per minute. Rationale. Breathing abnormalities are prioritized. Question 9. A nurse is unsure which intervention is correct for a confused older adult attempting to get out of bed. Which action is best? A. Apply restraints immediately. B. Increase observation and assess causes of confusion. C. Ignore behavior. D. Turn off call light. Answer. B. Increase observation and assess causes of confusion. Rationale. Least restrictive and assessment-focused interventions are preferred. Question 10. A nurse cannot remember the exact treatment for hypoglycemia. Which finding should receive immediate intervention? A. Blood glucose 42 milligrams per deciliter with diaphoresis. B. Blood glucose 110 milligrams per deciliter. C. Client sleeping comfortably. D. Client requesting water. Answer: A. Blood glucose 42 milligrams per deciliter with diaphoresis. Rationale: severe hypoglycemia threatens neurologic function and requires prompt treatment. Question 11. A nurse taking the Nclex encounters a difficult priority question involving 4 clients. The nurse does not remember the specific disease processes, but recognizes one client has a potentially unstable airway. Which client should be assessed first? A. A client 2 days postoperative requesting assistance to the bathroom. B. A client with chronic arthritis reporting pain of 6/10. C. A client with inspiratory stridor following thyroidectomy. D. A client awaiting discharge instructions. Answer: C. A client with inspiratory stridor following thyroidectomy. Rationale: even when uncertain, airway threats always take priority. Stridor suggests possible airway obstruction and requires immediate assessment. Question 12. A nurse is unsure about the pathophysiology described in a question involving a client with acute neurological changes. Which finding should receive immediate attention? A. Slight decrease in appetite. B. New onset unilateral weakness and slurred speech. C. Mild fatigue after physical therapy. D. Difficulty sleeping overnight. Answer: B. New onset unilateral weakness and slurred speech. Rationale: sudden neurological deficits may indicate stroke and require urgent intervention. Question 13. A nurse encounters a SATA question about a deteriorating client, but cannot identify the exact diagnosis. Which findings generally indicate the need for immediate evaluation? Select all that apply. A. Oxygen saturation 82%. B. Sudden decrease in level of consciousness. C. Urine output 10 milliliters per hour. D. Mild hunger before lunch. E. New chest pain. Answer: A. Oxygen saturation 82%. B. Sudden decrease in level of consciousness. C. Urine output 10 milliliters per hour. E. New chest pain. Rationale: when guessing, choose findings associated with airway compromise, neurological deterioration, perfusion deficits, or potential cardiac emergencies. Question 14. A nurse is unsure which intervention should be implemented first for a client who suddenly develops respiratory distress. Which answer is most likely correct? A. Notify dietary services. B. Complete discharge paperwork. C. Assess airway and oxygenation status. D. Review the client's insurance information. Answer: C. Assess airway and oxygenation status. Rationale: assessment of airway and breathing is a high-priority action when respiratory compromise is suspected. Question 15. An Nclex candidate encounters a delegation question and is uncertain about scope of practice. Which task is safest to assign to a UAP? A. Evaluate effectiveness of morphine administration. B. Teach wound care techniques. C. Perform initial postoperative assessment. D. Assist a stable client with feeding. Answer: D. Assist a stable client with feeding. Rationale: UAPs can perform routine, non-assessment, non-teaching tasks for stable clients. Question 16. A nurse cannot determine which provider prescription requires clarification. Which order should raise the greatest concern? A. Administer oxygen to a hypoxic client as prescribed. B. Obtain blood cultures before antibiotics when ordered. C. Administer potassium chloride for push. D. Monitor intake and output. Answer: C. Administer potassium chloride for push. Rationale: for push potassium is unsafe and requires immediate clarification. Question 17. A nurse is unsure which client should be assigned to the most experienced RN. Which client is the best choice? A. Stable client awaiting discharge teaching already completed. B. Client requiring routine vital signs. C. Client with rapidly declining blood pressure and altered mental status. D. Client ambulating independently. Answer: C. Client with rapidly declining blood pressure and altered mental status. Rationale: unstable clients should be assigned to the nurse with the highest level of expertise. Question 18. A nurse encounters a SATA question regarding signs of clinical deterioration. Which findings should be considered red flags? Select all that apply. A. Sudden confusion. B. Oxygen saturation 85%. C. New onset chest pain. D. Blood pressure 78/40 millimeter of mercury. E. Request for an extra blanket. Answer. A. Sudden confusion. B. Oxygen saturation 85%. C. New onset chest pain. D. Blood pressure 78/40 millimeter of mercury. Rationale: altered mental status, hypoxia, chest pain, and severe hypotension are indicators of possible instability. Question 19. A nurse is faced with a difficult NGN-style case. A hospitalized client develops increasing shortness of breath, restlessness, and oxygen saturation declining from 96% to 88%. Which action should the nurse take first? A. Document findings at end of shift. B. Assess respiratory status and apply oxygen per protocol, if indicated. C. Offer a snack. D. Ask family members to leave. Answer. B. Assess respiratory status and apply oxygen per protocol, if indicated. Rationale: assessment and support of oxygenation are immediate priorities when respiratory compromise develops. Question 20. A nurse encounters a SATA question and cannot remember the specific disorder involved. Which options represent the safest Nclex guessing principles? Select all that apply. A. Prioritize airway, breathing, and circulation threats. B. Choose assessment before implementation when more data are needed. C. Select the least restrictive intervention whenever appropriate. D. Focus on acute findings before chronic findings. E. Prioritize stable clients over unstable clients. Answer. A. Prioritize airway, breathing, and circulation threats. B. Choose assessment before implementation when more data are needed. C. Select the least restrictive intervention whenever appropriate. D. Focus on acute findings before chronic findings. Rationale: these are among the most reliable Nclex test-taking principles when the exact content is unclear. Unstable clients are prioritized over stable clients. Question 21. A nurse taking the Nclex encounters a priority question involving 4 clients. The nurse is unable to recall the disease-specific management for each condition. Which client should the nurse assess first? A. A client with chronic heart failure reporting mild ankle swelling unchanged from baseline. B. A client receiving 4 antibiotics who develops wheezing and facial swelling. C. A client requesting assistance to the restroom. D. A client asking when the provider will visit. Answer. B. A client receiving 4 antibiotics who develops wheezing and facial swelling. Rationale: when uncertain, prioritize signs of airway compromise and potential anaphylaxis. Question 22. A nurse is unsure whether to assess or implement an intervention first. A client who has been stable suddenly reports severe chest pressure and shortness of breath. What is the best initial nursing action? A. Obtain a complete dietary history. B. Assess vital signs and cardiovascular status. C. Document the complaint in the chart and continue rounds. D. Schedule client education. Answer. B. Assess vital signs and cardiovascular status. Rationale: assessment comes first when a client develops an acute change and additional information is needed. Question 23. A nurse encounters a delegation question involving a medical surgical unit. Which task is most appropriate to delegate to a UAP? A. Assessing a client newly admitted with pneumonia. B. Reinforcing discharge teaching for anticoagulant therapy. C. Ambulating a stable postoperative client who has already been assessed. D. Evaluating the effectiveness of a pain intervention. Answer. C. Ambulating a stable postoperative client who has already been assessed. Rationale: stable clients requiring routine care can often be safely assigned to a UAP. Question 24. A nurse cannot remember the exact complication associated with blood transfusions. 15 minutes after initiation, a client develops chills, fever, and shortness of breath. Which action should the nurse take first? A. Slow the infusion rate. B. Stop the transfusion immediately. C. Continue monitoring for another 30 minutes. D. Document findings and reassess later. Answer. B. Stop the transfusion immediately. Rationale: when a serious transfusion reaction is suspected, stopping the transfusion is the priority action. Question 25. A nurse is answering a SATA question regarding indicators of an unstable client. Which findings should concern the nurse most? Select all that apply. A. New onset confusion. B. Oxygen saturation of 83%. C. Systolic blood pressure of 76 millimeters of mercury. D. Sudden decrease in urine output. E. Preference for a different meal selection. Answer: A. New onset confusion. B. Oxygen saturation of 83%. C. Systolic blood pressure of 76 millimeters of mercury. D. Sudden decrease in urine output. Rationale: these findings suggest compromised oxygenation, perfusion, or neurological function. Question 26. A nurse is unsure which client can safely wait while another client is assessed first. Which client is the lowest priority? A. Client with respiratory distress and cyanosis. B. Client with active seizure activity. C. Client reporting sudden chest pain. D. Client requesting a blanket because the room feels cold. Answer: D. Client requesting a blanket because the room feels cold. Rationale: comfort needs are generally lower priority than actual or potential threats to life. Question 27. A nurse encounters an NGN-style question involving a client who suddenly becomes restless, anxious, and tachypneic after surgery. The nurse cannot identify the diagnosis but recognizes possible deterioration. Which action is best? A. Immediately assess respiratory and cardiovascular status. B. Provide routine discharge instructions. C. Ask the client to rest and return in 1 hour. D. Document anxiety as expected postoperative behavior. Answer: A. Immediately assess respiratory and cardiovascular status. Rationale: restlessness and tachypnea may be early signs of hypoxia or other serious complications. Question 28. A nurse is uncertain about which provider prescription should be implemented first. Which order generally receives priority? A. Schedule discharge teaching for tomorrow. B. Obtain daily weight next week. C. Administer prescribed oxygen to a hypoxic client. D. Complete routine admission paperwork. Answer: C. Administer prescribed oxygen to a hypoxic client. Rationale: oxygenation issues take precedence over routine care activities. Question 29. A nurse encounters a SATA question about NCLEX guessing strategies. Which principles are usually helpful when choosing between similar answer options? Select all that apply. A. Prioritize acute findings over chronic findings. B. Prioritize unstable clients over stable clients. C. Consider airway and breathing before comfort measures. D. Choose the least restrictive intervention when appropriate. E. Select answers that delay assessment. Answer: A. Prioritize acute findings over chronic findings. B. Prioritize unstable clients over stable clients. C. Consider airway and breathing before comfort measures. D. Choose the least restrictive intervention when appropriate. Rationale: these are classic NCLEX priority frameworks. Delaying assessment is generally inappropriate. Question 30. A nurse taking the NCLEX encounters a challenging priority question. For clients require attention. Which client should the nurse assess first? A. A client with chronic COPD whose oxygen saturation remains at baseline. B. A client scheduled for discharge in 1 hour. C. A client with sudden difficulty speaking and unilateral facial droop. D. A client requesting assistance with breakfast. Answer: C. A client with sudden difficulty speaking and unilateral facial droop. Rationale: sudden neurological deficits may indicate an acute stroke and require immediate evaluation. Question 31. A charge nurse is making assignments at the beginning of the shift. 1 newly licensed RN, 1 experienced RN, 1 LPN/LVN, and 1 UAP are available. The charge nurse must assign 4 clients, but is uncertain about the exact disease-specific needs of each client. Which client should be assigned to the experienced RN? A. A stable client awaiting discharge after successful completion of teaching. B. A client requiring routine hygiene assistance. C. A client admitted 30 minutes ago with chest pain and evolving ECG changes. D. A client scheduled for routine dressing changes. Answer. C. A client admitted 30 minutes ago with chest pain and evolving ECG changes. Rationale. When guessing on assignment questions, unstable, unpredictable, and high-risk clients belong with the most experienced nurse. Question 32. A nurse encounters a SATA question regarding findings that indicate immediate clinical deterioration. Which findings require urgent intervention? Select all that apply. A. Sudden inability to speak clearly. B. Oxygen saturation declining from 96% to 84%. C. Blood pressure 72/38 mm of mercury. D. New onset chest pain with diaphoresis. E. Mild boredom during hospitalization. Answer. A. Sudden inability to speak clearly. B. Oxygen saturation declining from 96% to 84%. C. Blood pressure 72/38 mm of mercury. D. New onset chest pain with diaphoresis. Rationale. Airway, breathing, circulation, and acute neurological changes always take priority. Question 33. A nurse is caring for 4 clients and must determine who should be assessed first. The nurse cannot recall the exact complications associated with each diagnosis. A. Client with chronic back pain requesting medication. B. Client with a blood glucose level of 38 milligrams per deciliter who is diaphoretic and confused. C. Client requesting discharge paperwork. D. Client asking for assistance with television controls. Answer. B. Client with a blood glucose level of 38 milligrams per deciliter who is diaphoretic and confused. Rationale. Severe hypoglycemia can rapidly progress to seizures, coma, or death and requires immediate intervention. Question 34. A nurse encounters an NGN-style question involving a client whose condition has changed over the last hour. Assessment findings include increasing respiratory rate, restlessness, declining oxygen saturation, and use of accessory muscles. Which interpretation is most appropriate? A. The client is improving. B. The client is stable and can be reassessed later. C. The client is showing signs of respiratory deterioration. D. The findings are expected and insignificant. Answer. C. The client is showing signs of respiratory deterioration. Rationale. Trend questions often reward recognition of worsening patterns rather than isolated findings. Question 35. A nurse is unsure whether an intervention should be delegated to a UAP. Which task is appropriate? A. Assessing lung sounds in a newly admitted client. B. Teaching a client how to self-administer insulin. C. Evaluating a client's response to pain medication. D. Obtaining routine vital signs for a stable client. Answer. D. Obtaining routine vital signs for a stable client. Rationale. UAPs may perform routine, predictable tasks but do not assess, teach, or evaluate. Question 36. A nurse encounters a SATA question about principles that frequently identify the correct NCLEX answer. Which strategies should the nurse apply? Select all that apply. A. Prioritize acute findings over chronic findings. B. Prioritize unstable clients over stable clients. C. Choose assessment before implementation when appropriate. D. Focus on airway and oxygenation concerns first. E. Ignore changes in level of consciousness. Answer. A. Prioritize acute findings over chronic findings. B. Prioritize unstable clients over stable clients. C. Choose assessment before implementation when appropriate. D. Focus on airway and oxygenation concerns first. Rationale. These principles consistently guide NCLEX prioritization. Changes in level of consciousness are significant and should never be ignored. Question 37. A nurse is caring for a client who suddenly develops severe shortness of breath after receiving a medication. The nurse is uncertain about the medication's side effects. Which action should be taken first? A. Assess airway patency and respiratory status. B. Document the finding at the end of the shift. C. Continue administering the medication. D. Provide routine teaching materials. Answer. A. Assess airway patency and respiratory status. Rationale. Acute respiratory compromise takes priority regardless of the underlying cause. Question 38. A nurse receives report on 4 clients. Which client should be seen first? A. Client with chronic atrial fibrillation whose heart rate remains unchanged from baseline. B. Client awaiting transport to radiology. C. Client with sudden onset unilateral weakness and inability to lift one arm. D. Client requesting a snack. Answer. C. Client with sudden onset unilateral weakness and inability to lift one arm. Rationale: new neurological deficits suggest possible stroke and require immediate evaluation. Question 39. A nurse encounters an NGN case study involving a client with sepsis. Over several hours, the client's blood pressure decreases, urine output declines, and mental status worsens. Which conclusion should the nurse make? A. The client is responding positively to treatment. B. The client is demonstrating signs of worsening perfusion and instability. C. The client can safely wait for routine reassessment. D. The findings are unrelated and not clinically significant. Answer. B. The client is demonstrating signs of worsening perfusion and instability. Rationale: NGN questions often test recognition of clinical trends indicating deterioration. Question 40. A nurse taking the NCLEX cannot determine the exact diagnosis in a priority question, but identifies one client with a potential airway problem. Which client should be assessed first? A. A client with mild nausea after lunch. B. A client with inspiratory stridor and difficulty speaking. C. A client requesting assistance with bathing. D. A client waiting for discharge prescriptions. Answer. B. A client with inspiratory stridor and difficulty speaking. Rationale: when all else is unclear, airway threats remain the highest priority under ABC principles. Question 41. A nurse taking the NCLEX encounters an NGN-style case study involving 4 hospitalized clients. The nurse does not recognize the specific disease processes, but identifies the following findings. Which client should be assessed first? A. A client with chronic kidney disease reporting fatigue that has been present for several weeks. B. A client recovering from surgery who rates incisional pain as 5/10. C. A client whose oxygen saturation has dropped from 97% to 82% despite oxygen therapy. D. A client requesting assistance with meal selection. Answer. C. A client whose oxygen saturation has dropped from 97% to 82% despite oxygen therapy. Rationale: severe hypoxemia represents an immediate threat to life and takes priority over chronic or comfort concerns. Question 42. A nurse encounters a SATA question regarding findings that suggest immediate instability. Which findings should be recognized as high priority? Select all that apply. A. New onset confusion. B. Sudden chest pain with diaphoresis. C. Oxygen saturation of 81%. D. Blood pressure 78/42 millimeter of mercury. E. Mild constipation for 2 days. Answer. A. New onset confusion. B. Sudden chest pain with diaphoresis. C. Oxygen saturation of 81%. D. Blood pressure 78/42 millimeter of mercury. Rationale: these findings suggest compromised neurological function, oxygenation, or circulation. Question 43. A charge nurse must assign clients to staff members. Which client should be assigned to the LPN/LVN? A. A client requiring initial admission assessment. B. A client requiring discharge teaching for a new diagnosis. C. A stable client requiring routine medication administration and dressing changes. D. A client with rapidly worsening respiratory distress. Answer. C. A stable client requiring routine medication administration and dressing changes. Rationale: LPN/LVNs generally care for stable clients with predictable outcomes and do not perform initial assessments or comprehensive teaching. Question 44. A nurse is caring for a client whose condition has progressively worsened over the last several hours. Assessment findings include increasing confusion, decreasing urine output, hypotension, and tachycardia. What is the nurse's priority interpretation? A. The client is improving as expected. B. The client is experiencing worsening perfusion and possible shock. C. The findings are unrelated. D. Reassessment can be postponed. Answer. B. The client is experiencing worsening perfusion and possible shock. Rationale. Trend recognition is a major NGN skill. Multiple worsening indicators point toward instability. Question 45. A nurse encounters a difficult prioritization question and cannot remember the exact pathophysiology involved. Which client should be seen first? A. A client with a new tracheostomy who is unable to clear secretions and appears distressed. B. A client requesting assistance with hygiene. C. A client awaiting routine laboratory testing. D. A client asking for a sleeping aid. Answer. A. A client with a new tracheostomy who is unable to clear secretions and appears distressed. Rationale. Airway problems always take precedence when prioritizing care. Question 46. A nurse encounters a SATA question regarding effective Nclex guessing principles. Which strategies are generally reliable when selecting an answer? Select all that apply. A. Prioritize airway, breathing, and circulation concerns. B. Prioritize acute changes over chronic findings. C. Prioritize unstable clients over stable clients. D. Select the least restrictive intervention whenever appropriate. E. Delay action when serious symptoms are present. Answer. A. Prioritize airway, breathing, and circulation concerns. B. Prioritize acute changes over chronic findings. C. Prioritize unstable clients over stable clients. D. Select the least restrictive intervention whenever appropriate. Rationale. These frameworks consistently help identify the safest nursing action. Question 47. A nurse is unsure whether to assess or implement first. A stable client asks for pain medication for chronic arthritis pain, rated 4 out of 10. Which action is most appropriate? A. Assess the client's pain and relevant factors before intervention. B. Ignore the request. C. Call the provider immediately without assessment. D. Delay evaluation until the next shift. Answer. A. Assess the client's pain and relevant factors before intervention. Rationale. When additional information is needed and the client is stable, assessment generally comes first. Question 48. A nurse receives report on 4 clients at the start of the shift. Which client should receive immediate attention? A. Client awaiting discharge paperwork. B. Client with blood glucose of 34 milligrams per deciliter who is difficult to arouse. C. Client requesting a change in diet order. D. Client asking about visiting hours. Answer. B. Client with blood glucose of 34 milligrams per deciliter who is difficult to arouse. Rationale. Severe symptomatic hypoglycemia is an emergency because it can rapidly lead to seizures or loss of consciousness. Question 49. An NGN-style case study presents the following trend data for a hospitalized client. Blood pressure, 124/78, 102/64/84 millimeter of mercury. Heart rate, 88/108/126 per minute. Urine output, 45/25/10 milliliters per hour. Mental status, alert, restless, confused. Which interpretation is most accurate? A. The client is demonstrating expected recovery. B. The client is experiencing progressive hemodynamic deterioration. C. The findings are normal variations. D. The client can safely wait for routine reassessment. Answer. B. The client is experiencing progressive hemodynamic deterioration. Rationale. NGN questions frequently test the ability to recognize worsening clinical trends rather than isolated values. Question 50. A nurse taking the Nclex reaches the final question and is completely unsure of the diagnosis being discussed. The nurse identifies one answer option focused on a client with compromised oxygenation and another option focused on a client requesting comfort measures. Using the safest Nclex decision-making framework, which option should the nurse choose? A. The client requesting an extra pillow. B. The client asking when lunch will arrive. C. The client with signs of compromised oxygenation and respiratory distress. D. The client requesting assistance locating personal belongings. Answer. C. The client with signs of compromised oxygenation and respiratory distress. Rationale. When uncertain, prioritize life-threatening problems involving airway, breathing, circulation, neurological status, and safety before comfort or convenience needs. Passing the NCLEX is not about guessing randomly. It is about making the safest clinical decision when you are uncertain. The most successful NCLEX candidates consistently apply core prioritization frameworks: airway, breathing, circulation, ABC, acute before chronic, unstable before stable, assessment before implementation when appropriate, least restrictive intervention, safety first, recognize clinical deterioration trends, expected versus unexpected findings. When content knowledge is limited, these principles often lead to the safest and most defensible answer. The NCLEX is designed to test clinical judgment, and these strategies help guide that judgment under pressure.